Hi, I'm Andy McCullough. Welcome to A Few Minutes with Andy. This is the inaugural weblog as part of my private practice, Better Feelings. Better Feelings is a counseling and consultation practice in Little Rock, Arkansas that provides both individual and group psychotherapy as well as corporate trainings and consultation for new professionals in the counseling field. I've developed this weblog in order to provide information to new professionals, clients, and colleagues in hopes that eventually this will grow into training activities. Today, I want to discuss professional development. I think professional development is incredibly timely today as we are about a week away from college graduation. Today, the class of 2020, particularly the graduate counseling class of 2020 is going to start making some decisions about what's next. Now, I work as a counselor, a clinical leader, and a clinical instructor. I work a lot with graduate students, and one of the questions I'm often asked is, how do I develop competency? This is what I really want to do. Now, how do I get from graduate school to where I want to be? Now, that's a really good question. My first advice to any person finishing graduate school, making the decision about what's next, is look backward. What have you been doing for the past year? What have you learned in your internship? There's a good chance that the lessons learned, the real life lessons learned at the internship with real live clients, is going to provide a map towards the first years of professional practice. If you've gained experience working with addictions, affective disorders, depression, anxiety, if you've been working with clients with anger management problems, if you've been working with clients with substance abuse problems, it's a good chance that this is going to be the direction your career takes, at least for your first job. Now you ask, what if I don't want to do that? Well, if you don't want to do what you've been doing as a behavioral health professional, you have a responsibility to develop competence. It is ethically imperative, it is an ethical imperative that you only practice within the scope of your competency. This is a requirement of the Arkansas Board of Examiners and Counseling, the Arkansas Social Work Licensing Board, and the American Counselor Association Code of Ethics. In fact, in Arkansas, the ACA Code of Ethics is codified in the counseling rules and regulations. This means that ethical violations in Arkansas carry the weight of law. Now, that doesn't mean that if you weren't doing what you wanted to do in your internship, that you are locked out of what you want to do. In fact, the counseling and social work fields are incredibly broad. Some of the issues that counselors and social workers can do career-wise include individual and group therapy, prevention activities, career counseling, corporate work, wellness programs, health and wellness programs within the corporate world, education, both, elementary, secondary, higher education, positions within law enforcement, family work through social services agencies, as well as marriage and family therapy, couples therapy, working for agencies within the government, nonprofit work, nonprofit leadership, things as simple as working with the Boy Scouts or the Girl Scouts. There are incredible opportunities for individuals who have experience within the behavioral health field. However, those opportunities only come with competence. So, the ways to develop competence, number one, is to gain education. There is no better place to gain education than the university. I suggest if you want to increase competence, go back to school. While you're in grad school, take the classes that match your interests. CACREP, which accredits counseling programs, has a roadmap of courses that effective counselors take to develop a broad range of competencies. However, some of these courses are just the foundation. For example, KCREP requires that all counselors be competent in substance abuse by the time of graduation. However, they only mandate one course to gain this competency. Of course, it's impossible to be fully competent with one graduate level course in substance abuse counseling. So education is the first step, but the second step is to get on-the-job training. Now, the way to do this is as you go forward, as this summer, while you're looking for a clinical supervisor to begin your practice, look for a clinical supervisor who possesses the skills and the experience and the talent that match your desires. For example, I provide clinical supervision, and my areas of expertise is trauma work, addictions, and affective disorders. If you want to work with schizophrenics, I'm not the person to come to. However, if you want to work with individuals who have long histories of addictions, I can help you develop into a competent professional in that area. As you look for a clinical supervisor, go to the board, get a list of potential clinical supervisors, ask college professors who they might recommend, ask people in the field who they worked with. This is an important choice. Shop around and interview these individuals. Any clinical supervisor who would be willing to work with you would be willing to be interviewed because that clinical supervisor, he or she recognizes the value of clinical supervision. Now, education, clinical supervision, and experience, these all work together for the development of competence. Now, as you go forward through the initial licensure stage this summer and you start looking for your first job, look for jobs that match what you want to do. Now, I will tell you, there are agencies in Little Rock, there are agencies across Arkansas, across the Southeast that will hire you despite your lack of competence. You have a responsibility as a professional. You have an ethical responsibility to only work within your scope of competence. Don't take a job at a substance abuse treatment agency if you don't know how to treat substance abuse. Don't take a job working with suicidal clients if you don't know how to recognize the signs of suicide. It is absolutely irresponsible. I have a clinical supervisee that I work with, and I always encourage him to think about 12 people on a jury when he tries to decide whether he has the ability to practice with a particular diagnosis. For example, if it's suggested you work with an alcoholic and you have no experience working with an alcoholic, and that person leaves a session, gets drunk, and kills people driving away. When you are in court and you're asked, what was your experience? What was your preparation? What was your education for treating this individual? You know, those 12 people that are standing in judgment of you, what would they say? What would they say about your preparation? If you say, well, I watched a YouTube video, or I went to a weekend seminar, or I read an article in a counseling journal, do you expect them to pass a favorable judgment? Absolutely not. Okay? So use the jury test to gauge whether or not you possess the skills. If you were seeing a brand new dentist and he recommended that you be the first person for his very first root canal, would you feel comfortable? Well, our clients deserve no less than that person. So don't make your clients the guinea pig for your learning process. If you do develop the education earn the education, then work with a qualified supervisor in the initial stages of gaining the experience. And then, after that period of clinical supervisor, maintain a network of professionals that you can regularly consult with. I've been practicing for more than 15 years as a therapist. I continue to have a network of practitioners that I regularly discuss issues with. I trust these people to have the answers when I don't have the answers. That means also that I regularly reflect on my own skills and I look for my own blind spots. What do I not know? Because I don't want to find out what I not know in session. I want to know what I don't know before I go into session. That's part of the responsibility for what we do, working with real people in real situations as real therapists. So, as you this summer go from graduate school to the counseling profession, I encourage you to reflectively examine what you've learned, where you've been, and where you want to be, and develop a plan to get there. Again, this was the inaugural session of A Few Minutes with Andy. We're going to discuss other topics in the coming weeks. My contact information is on this webpage. You can email me at betterfeelings@therapist.net. And I'd be happy to take feedback or suggestions for either this session or future sessions. Thank you very much.